Hello. Hi, what's going on today?
I don't know. We were just watching TV and he started making weird noises and his vent was alarming. I'm not really sure what's going on.
Okay. We'll get his appearance. Work with breathing, circulation. All looks okay.
So you'll notice that when this crew comes in, they're already working through their systematic approach. They're working on the PAT as they walk in the doorway, and before they get to the patient's side, he's already verbalized that he's worked through the PAT. There's a difference in a PAT and a primary assessment.
Yeah, your PAT is going to be happens within seconds, and it's before you ever get to the patient's side. So what's important to note is it's very similar to like you equate it to your windshield survey. So you show up on a vehicle accident, you see your patient, you haven't even exited the vehicle yet. For the PAT, we're talking about for pediatric patients, is when you get to that doorway, you cross the threshold and you see the patient for the first time. It's going to happen within seconds. Part of the PAT, we start with our appearance, right? How does a patient present? Are they sitting on the parent's lap or the caregiver's lap and acting completely normal? Or do they look unresponsive? We're looking for work of breathing. So how does their work of breathing? Is it fast, slow? Do you see accessory muscle use? And then we're also checking for the circulation. We're looking for the color. Are they perfusing? Are they cyanotic? Are they mottled? Are they pink, warm, and dry? Or I wouldn't say warm because you haven't touched them yet, but are they pink, right? So once we're completed with that, we determine that they're quick or not quick.
So approaching this patient, they've already decided that this patient is quick or not quick. But with patients with special healthcare needs, it's a little bit more difficult. So this patient isn't age appropriate in comparison to a healthy, normal patient without special medical needs. So we talked about that a little bit earlier in our PowerPoint. So they're going to have to do a thorough assessment and talk to the caregiver to find out what's normal for this patient. They approach the patient and then they start working through their primary assessment.
All right, we'll continue on with the video and the scenario and see what they do next.
Everybody's fever's fading. Breathing. Looks like he's having some seesaw breathing. Yeah, his pulse feels regular. So you said he was having some trouble breathing. How long has it been since he's started to have some trouble breathing?
Probably about 5 minutes.
5 minutes, okay. All right, and how old is he?
He's 2.
He's 2, okay.
I'm just a babysitter. I mean, his mom just ran to the store.
Okay. All right, he's 2 years old. Quick listen lung sounds here. Lung sounds clear. Sounds like he's grunting. All right. So do you know anything about his medical history, about why he is on a ventilator?
I know his mom said that he had an anoxic brain injury. I don't know much other than that.
Okay. And have you been in contact with the parents?
Yeah, I called her before I called you guys. She said she wants him to go to the hospital.
Okay. All right. We'll go ahead and get him on capnography. You can use the adult cap now.
Okay.
Here, get it for you.
You think we should call for a CCT truck?
We have to actually go through the process of assessing the patient a little further, and then we can do a med consult in order to contact or request CCT. All right. And he is vent dependent?
Yeah.
Okay. All right. So what we can also do is we can try suctioning as well.
I know when this happened before, I've seen them use this, but I've never done it myself. I don't really know how to use it.
All right. So what we'll do is suction unit. Okay. All right, look up here. All right, buddy. Here we go. And out. All right. Do we have any increase in pulse ox there?
Pulse ox is up to 90%.
Okay. All right. So we're gonna try to consult for a CCT unit for a vent dependent patient. Rescue 42 med alpha.
Med alpha, go ahead, rescue 42.
Looking for a med consult for a upgrade to CCT unit for a 2-year-old vent dependent patient.
Copy that. Unfortunately, CCT is currently unavailable.
Rescue 42 copy. Do you think we could get a critical care paramedic unit on scene, please?
Copy that. Let me check, see if there's one available.
Rescue 42 copy. Thank you. All right, so they're going to check that. We'll just keep monitoring. How's the pulse ox now?
Still at 90%?
90%. Okay, we're gonna go ahead and try to suction again. All right.
Knock, knock.
Hello.
So there's a few things I like that they did here. One of the things I noticed is they went right into that hands-heavy bag and they pulled out that length-based tape.
Yeah, they did that because when they walked in, the caregiver said that the child was 2 years old. But one thing they noticed is it really didn't match up to, didn't look like a 2-year-old. And that might be because it was a special needs child. So what they did is they decided, you know what, let's go ahead and pull out the link-based tape, see what the actual size of this child is, so we know what equipment to use out of the hand heavy, and we know what protocol to turn to in that book, right, or medication equipment guidebook.
Yeah, so we talked about that. Patients with special medical needs, they may not look the same as other children their age. So they did a great job with that. Another thing they did here is they talked about doing a med consult for critical care transport. The first thing is you don't really have to do a med consult for that, but you should go over to Med Alpha and see if there's one available if you feel like you might need that resource, the extra training, or somebody that knows how to operate the vent, because the caregiver's not here in this situation to operate the vent.
Right. I mean, CCT could be on another call. They could be out of the county. They could be another interfacility transport. So we can't just put them on the call automatically. So what are our alternatives? If we call them and they're not available, what do we have?
Well, there's a few things to think about. The first thing is that if this is a category red patient, you're not even going to consider that. If it's a category red patient, you're going to bag this patient to the hospital, or if a caregiver is available, then you're going to have them operate the vent, because those patients just need to go and be transported. If your patient's stable and you're suctioning and the SATs come up and you feel comfortable, then you can take a moment and do that, not consult, but you can jump on Med Alpha. And
You can ask for a critical care paramedic, right?
Right, so critical care paramedic
Right.
is similar to critical care transport in that when you have CCT, they come in the truck, you have a nurse, a paramedic, an EMT, and a full crew, but they might be busy on another call doing interfacilities or something like that. So there are paramedics out there that have that advanced level training and additional tools on their units.
So they have vents, right?
Yeah, they have vents.
Okay,
And
perfect.
they're also trained on how to operate the vent.
All right. So once they went ahead and called, they got approval for a critical care paramedic crew to show up on scene. But what they did is it continued on taking care of the patient. So one of the things they did identify, we talked about it a minute ago, was they needed a suction, right? They had lower 2 sats. It was identified when they walked in that there was a ventilator problem, and identified that maybe that trach needed to be suctioned, right? So the crew went ahead and suctioned that. Now, it had the device where we can actually go in and suction. We didn't have to use any special equipment, so we can use their equipment, right?
Yeah, if they have it there, obviously you have something great at your fingertips. If you have the caregiver there, that's always the best resource. In this case, they didn't have that, but they know how to use that equipment. And if they didn't, we have equipment in our bag, and they use that length-based tape as we discussed earlier. So
Yeah, there's no guessing about what size French catheter do I need.
Right.
So one thing to note with the suctioning, especially with trachs, we do have a protocol for tracheostomy, so you can use that at your disposal. But when you're suctioning, make sure that you only suction for like 10 seconds at a time before you let them reoxygenate. Okay, keep those oxygen saturations elevated.
all right. So let's see what happens next.
Hey, what's going on?
All right.
You said you're going to call for a CCP.
We did. So we have a 2-year-old vent-dependent patient having some trouble breathing on arrival. We found with the low 2 sats at about 82%. Patient's 2 years old, but on the tape measuring out to be 1-year-old. We are requested a CCT truck. They said they were busy right now doing other transport. So we requested you here due to the ventilator. Patient is vent dependent. This is the babysitter.
Okay.
So we're looking to get the patient down to the hospital as quick as possible.
Okay, and you said it was what? Why are they on the vent?
Anoxic vent,
Okay.
brain injury.
And have you contacted mom, dad?
I called her
caregiver?
before I called you guys.
Okay. So, I mean, I've got my vent, but is mom and dad going to meet us at the hospital?
They're gonna meet us. I don't feel comfortable operating his vent.
But they're okay with him going on
Yes.
that vent? Okay.
Yes.
So we can just use their vent since the little one is already accustomed to it. That way they're not on some strange vent.
Gotcha.
And then, we've always got mine as a backup. So, but do one of y'all mind riding in with me?
Not at all. We'll
Okay.
come right with you. Do you, the O2 sats, have they increased at all?
Up to 94%.
94, okay.
Okay.
So we're doing better here. We're suctioned twice so far.
Okay, cool. So let's go ahead and do that, and we'll get the stretcher in here. We'll unattach that from the wall, and then we'll get going.
All right,
Okay.
sounds good.
All right, so the Sunstar critical care paramedic shows up on scene. It's really good to work within the crew resource management, right? You want to go ahead and have a comprehensive report. Why did you get called out? What have you done so far? What have you identified? So they did a really good job providing that information. They were communicating very well.
I agree.
What are we going to do with the family member if they're not on scene, or with that caregiver that was on scene?
So in this case, the patient is stable and you have a lot of people on scene. So if you have extra people on scene and your patient is stable, you can reach out and contact the caregiver, make sure that you know more about the patient, about the ventilator, and what their wishes are for their child.
Yeah, the family is going to be the most important thing for when it comes to history. Family members of special needs kids, they're going to know the ins and outs, and probably more than you do, especially if it's something that you're not really familiar with.
Yeah. So in this case, unfortunately, the babysitter didn't know a lot about the patient's medical history or how to operate the ventilator. So luckily, there was a critical care paramedic nearby that knows about the vent and has a vent with them. So
now we talked about quick versus not quick, and we also want to talk about destination. So we talked about quick versus not quick earlier in the scenario, and they identified that really early after the PAT, right? But that doesn't mean that we scoop the child up and run if it is a quick patient. It just means that we put the computer down, we get additional resources, and we work on fixing what's going on, right? In this case, it was a low 2-sat, difficulty breathing. But when we identify that and we determine this is going to be a stable patient, we contacted the critical care paramedic. Where are we going to go? Where are we going to transport this patient?
we definitely want to try to take this patient to a facility that they've been to before. A lot of time, these patients with special healthcare needs have a facility that is their home medical facility. So they know the patient, they have their medical records, and obviously mom and dad are going to be more comfortable with the patient going there.
The only time that we'd want to divert is going to be when we have an airway compromise, right? If the patient starts to crash, if you have the inability to ventilate the patient, we need to go ahead and transport to the closest hospital, even if it's not a pediatric, right?
Right. I mean, if you can't manage the airway, you have to go to the closest facility.
Yeah, we have our bench strength, as we like to say, right? We have additional people there to help us out. What about reassessments? How often are we going to reassess our patients?
So you want to make sure that you reassess your patients every 5 minutes, especially with an airway problem. So in this case, it's just important for them to reassess the patient.
Right, so it's not just vital signs, right? So we're reassessing any interventions. They identified in the scenario where the oxygen saturations kind of stayed a little low, and they went ahead and resuctioned, right? So you can go back and any interventions that you take care of, revisit them. Did it work? Is it still working? Do we need to do it again? Is there something else we need to do? So plan 2 or 3 steps ahead just in case something does happen.
Right. Another thing to consider is what's the normal oxygen saturation for this patient. So we don't have the caregiver there, but finding that information out will help you to understand, what is their normal. So we're going to watch another scenario here. This scenario is a little bit different, but this is still a pediatric patient with special medical needs. The patient is not on a ventilator in this situation. The patient does have a trach.
So what we're going to do is we're going to identify in the scenario some of the different equipment that we have that we're going to use to manage this patient. Again, they're going to go through and do their assessment, identify what the problem is, working through that systematic approach, identifying what the differential diagnosis is and how they're going to treat it. You ready to watch it?
Yep.
All right.
Hello, what's going on today?
Oh, good to hear. I don't know. I just called because he's like making weird noises.
42 patient.
I don't really know what's going on with him.
Okay.
Yeah.
It appears he's having a little more work of breathing. He's having some seesaw breathing right now. Go ahead and listen to some lung sounds. So what's his what made you call today?
He's just like making weird noises. I don't know. I mean, I'm just watching him. I'm just babysitting, but he just like seems like he started making weird noises a couple of minutes ago.
Okay.
I don't really know what to do.
I think they've watched enough videos. Let's speed this up a little bit.
Yeah, I think they understand what happens now. Let's get to the point.
Knock, knock. Hey guys, what's going on?
How you doing?
Hi.
So we've got a 2-year-old male. He is a trach patient. He's meeting at the size of a 1-year-old according to our tape. He is had a hypoxic brain injury and is malnourished at birth. He is Not acting right. He's having some trouble breathing. He's having some seesaw breathing we got here. The lung sounds appear to be clear. He's grunting as well. We got him on oxygen. We switched him from their mask to ours. It sounds like he's still kind of working pretty hard to breathe.
Okay. Have we tried the suction? Because I brought a suction canister. Just
We have
in
not. We
case.
would like
So,
to.
okay.
We'd
So,
like to do this.
we got the. So I'll grab all this stuff.
Hand it in here.
Oh, okay. Just put that on the half power, please. Okay. So if you hold that for me. Okay, buddy. Here we go. Okay. That oxygen. So what was the O2 sats when y'all got here?
It was in the low 80s.
Okay. Okay.
So-
And you are.
I'm a babysitter.
Okay. Okay. And then where's mom and dad or guardian? Or...
They went to the grocery store. I called her before I called you guys.
Okay.
She said she wants them to go to the hospital.
Okay. Has we got any improvement on that oxygen?
It's up to 90.
Okay. Let's do this one more time, and then we'll get him switched over and get him going. How's that sound?
Sounds good.
Okay, buddy. Here we go. Okie dokie. Put that for me.
Alright. Oxygen numbers should improve there for us.
Okay. Okay, can you grab that mask and I'll put this one, we'll switch him over and then we'll get him on our stretcher and go. Okie dokie. Here we go, buddy. Just that a little bit. Okie dokie. So, well, let's get the stretcher in here and we'll get him going, okay?
Now you've watched the scenario, you can see how knowing your tools and equipment help you to treat and properly transport these patients.
Right, so they identified when they walked in, the patient was having some difficulty breathing, which is why the caregiver called 911. So they did their assessment, identified the oxygen saturation was 80%, and there might have been some sort of issue with the trach patient that was not on a vent. So they had a basic mask over the trach, and it obviously wasn't working. So what they did is they went ahead and decided, let's go ahead and use our own equipment. We'll put the patient on a simple mask and just place that over the trach. And then when Sunstar shows up, we started to get a little bit more in depth with the differential diagnosis. What were some of the issues? They identified that maybe the patient needed to be suctioned. So they went ahead and removed the simple mask. They used their French catheter, and they found that in the hand heavy bag. So they already identified that it was a 1-year-old, or at least the size was a 1-year-old, and they went ahead and suctioned that patient.
Yep. So they did a really good job knowing their tools and finding the tools that were appropriate for this child. They also did some troubleshooting there, so that was pretty good.
Yeah, one of the things too they identified is making sure that when we're going to suction, especially for pediatrics, with our equipment, you want to make sure you pull that back to half power, right? The little white knob on the side, to make sure you're not overpowering that suction.
Yep. They also had pretty good communication here, and they talked about communication with the caregiver, so they covered a lot of things here. One of the things that was mentioned here that we found that not everybody knows about, if you're transporting a patient from a facility or a home that is on oxygen and has a trach, there is a tool that Sunstar has in a speed loader up in their cabinet. It's called the Venturi mask.
All right, what does a Venturi mask do?
So you can, a lot of times you end up in a situation where the device that they have that they're using for oxygen doesn't work with our regulator.
Okay.
So in this situation, you can get that mask. Of course, it hooks up to our equipment, and there's a paper in the bag, and usually the caretaker or the facility will tell you at what percentage you need to run their oxygen.
Okay.
So this will give you the information that you need, and you can switch over from what they have to what we have. So you don't just have to grab like a non-rebreather or something and throw it over the patient's trach. We have a tool. So
we don't have to bag the patient all the way to the hospital,
No.
unless it's an airway compromise, you
Right.
can't get the oxygen saturations up,
Right.
things like that. So then they hook that up and they go to the most appropriate hospital, which in this case is going to be a pediatric facility, or like we talked about in the last scenario, which is going to be the hospital they typically go to.
Yeah, their medical home facility. And of course, the caregiver will be able to let you know what that is. And if you have a patient that has a compromised airway, we're always going to the closest facility.
All right. Hope you guys were happy that we fast forward after that scenario.